This is Jenna Cantor. Welcome to another episode on Physiotherapy Performance Perspectives. I'm here with Julia Iafrate, who is a physiatrist who works with performing artists and at Columbia, correct? In New York?
Mm-hmm.
Absolutely incredible to have you on here. First of all, thank you so much for coming on.
Thanks. Happy to be here.
This is so great. So for performers, if you want to get in touch with her, I will be including the bio and ways to get in contact with Julia within the description of this. In the meantime, let's jump right into what we are covering today. We're talking about the top 10 things that get in the way of a performer rehabilitating from an injury. Very excited. I like these top 10 lists, and you're my first one.
Oh, well, good.
10,
Thank you.
5. I'm like, yeah, we're doing bullet points. That's how I read.
It makes it easier. It makes it quick, and gets everything you need.
Yes, quick and not dirty. Quick and clean.
Yes, quick and clean. Quick and very nicely laid out.
Yeah. All right, so let's just jump right in. What's number 1?
Okay, so I actually did it from 10 down, if that's okay with
10,
you.
I like that, like MTV.
Yeah, countdown. Yeah, exactly.
Yes.
So I think the most obvious and the most troublesome one for performing artists across the board is lack of insurance or lack of access to quality medical care, whether that's physicians, whether that's physical therapy, whether that's psychology. I mean, any of these things that they require, either their lack of insurance or poor insurance makes it really difficult for them to get access to the people that they truly need to be able to be managed through a lot of these issues appropriately.
I think that's so true. I actually just worked with a musical theater performer the other day, and he was in his early 20s, and he was getting help with insurance, from his parents still after school. But the problem is that his insurance was so bad. It was from a different state. He wasn't covered at all, except for emergencies here in New York. And it just left him in a horrible pickle. So I have a cheat sheet that I give my patients. And then I also forwarded him to the Actors Fund. And they are spectacular. They have a course there. So for those who think that, it's not possible, there is always a way to get insurance. There are many different options. And you bring up a great one. I'm glad you put that on there.
Yeah, absolutely. And then the next one, so top number 9 is, I think we don't do screening for dancers. So pre-participation exams exist with every other sport. In high school, in college, we do these. We don't do them for dancers. And so they go into dance without knowing what their baseline is. And they go in without us knowing what their baseline is. So it becomes very difficult for us to care for them. And so again, that becomes something that kind of gets in the way of their rehabilitation down the road because we don't know what their baseline was. And so I call that maybe a lack of education as well, being provided to the dancers to be able to say, like, look, these are the things you need to be looking for. Those are easy discussions that we normally have during pre-participation exams, but because we don't really do them in dance, it's a big issue.
Yeah, what do you suggest they do?
So,
on top of it.
Great question. So, a couple of my colleagues and I, and a few physical therapists in New York area that also work with performing artists, we're trying to create like a functional movement exam, basically, where we do it for free and have dancers come in. We do 50 in one evening, but just basically do like a pre-screen to try to go through and create something similar to the pre-participation exam. So we do have kind of a baseline. We've done like a pilot test so far on 10 dancers, and they all received it really, really well, and we're very happy with it. And so we're going to try to get that to kick off sometime in this new year. So I think that can be one way to do it. The other thing is, maybe finding, doing a little bit of research and finding either your physician or a therapist that's comfortable with doing kind of a little bit of a pre-part exam on your own. And just that way, your own baseline, because we have to take responsibility for our own bodies too. That's also so important.
And for the performer, you went into it a little bit, but would you mind diving in a little bit more on why it's so important for them to get a screening?
Yeah. So dance doesn't stop. there's no off season really. And so it's really easy for injuries to kind of build on top of each other. And if you don't have kind of that baseline to know where they're starting from, to notice where maybe some neuromuscular development has kind of faltered in some areas, or it's lagging behind other areas, that can end up becoming an issue and creating injury down the road.
Yeah, that's great. Thank you. All right,
Yeah.
8. Let's do 8.
8, time. They don't have time. Nobody has time, especially in New York City. So a lot of my dancers and my performing artists have complained that they practice very often. It's difficult to get in to see me, especially, they get injured on a Saturday performance and I'm booked out 3 weeks. What is that going to do for them? And so we've actually, I convinced my higher ups at Columbia to let me actually do an evening clinic on Mondays that's specifically for performing artists. So it's from, 3 to 8 p.m. because Mondays are usually dark days in New York. And so that way it gives them that period of time when they can actually be seen and not have to miss practice. Because as you might know, you don't want to miss practice because then you might get moved out of your position. And
it's your job.
Yeah, it's their job. Exactly. And so nobody wants to miss it, especially if they're passionate about what they do. And so I think finding ways to get access to care and having the time to do it is a huge factor in the rehabilitation.
Absolutely.
Yeah.
All right, 7.
7, I put, this is kind of a little bit of a broad one, but the aging process. So as we age, as we move through dance, again, some of these other factors kind of add into that, but you start to build up these injuries over and over and over as time progresses. And then all of a sudden you kind of age out and then your insurance is gone and you don't really have any benefits to speak of. And so this aging process ends up creating a great amount of wear and tear on the body that it's not supposed to have. I mean, dancers put themselves into positions that are fairly abnormal to normal human movement. And so the stress that goes through their body is significantly different from the average person. And so the aging process can make it just very difficult to rehab them in a way that's kind of maybe more intuitive for how you would rehab somebody who is not a dancer.
Does that mean there's not a solution for them, or is it still something workable?
No, I think it goes back to education. I think dancers are becoming a lot more educated. Medical providers are becoming a lot more educated about dance medicine. It's, this subset of sports medicine now that people are practicing. And so I think all of those things are adding in to kind of help with this process of aging with the dancer. There's also, dancers are dancing longer than they used to, right? When was there a principal dancer over 40 back, in the 80s? There wasn't, but now there is. And so I think that's another thing, is that because they're performing for longer, we have to really work with them to try to maintain the strength and the function that they have.
Yeah, saying it's not possible is not an option.
No, of course not.
This is their passion.
This is their livelihood. Mm-hmm.
Yeah, and for people listening, when we're saying dancers, if you're an actor, you're still included in
that. Counts. Musical theater.
You're doing things regularly. You're doing the same type of movements, pushing furniture, walking the same steps, very possibly leading with the exact same foot.
Absolutely.
Every time you come on and come off the stage for your scenes. It could be circus performers. I mean, it really, if you're just in the performing arts, this does include you for sure.
Yeah.
All right, number 6.
So this is a term, I'm not sure if I've coined it or if somebody else coined it. I don't know if anybody else calls it this, but this is what the term I use. So number 6 is called stacking. So stacking is simply stacking injuries. So you get one small injury, maybe you roll your ankle and you have an ankle sprain, but then you continue to dance through that ankle sprain, and then you end up tweaking your knee, and then that ends up affecting your turnout. And so then you start getting, some glute med tendinopathy. Or same thing with a musician. They have this position for so long that they start to get symptoms of carpal tunnel syndrome. And then they start getting maybe a radial nerve palsy. So there's this stacking of injuries, again, because we start to try to ignore the problem first. And then when
like, the producer doesn't know, so I don't know either.
Let me just cover this one up with this other issue. And so what I often explain to my patients, the performing artists, whatever they are, I say, you're like an onion. I mean, we have to take this one layer at a time because there's a lot happening here. This isn't one problem. And so I think that to be able to take that approach and look at the patient a little bit more holistically and say, okay, how is all of this affecting each moving part of this entire person? I think that's the way that we're going to help them rehab better. Otherwise, yeah, it's going to be a huge deterrent to them.
And that connects back to your importance of screening.
Correct. Exactly.
100%.
Yeah.
All right. We're on 5. Ooh,
5.
We're at the 5. We're at the hand now.
5 mark. So 5 is probably a little bit more dance and musical theater specific than it is for perhaps the musicians, but I use hyperflexibility as one of those because, again, generally speaking in life, hyperflexibility is not a great thing. If you're too flexible, you have people that have like Ehlers-Danlos, which that is not promising.
You read my mind. I was literally thinking that.
Nobody wants that.
That's when you're so hypermobile. It's actually, it has a clinical diagnosis.
Yes, it's detrimental to you because you start
dangerous.
subluxing, you dislocate a lot. And so, but unfortunately, hyperflexibility is wonderful in dance, right? So we end up selecting for people that are hypermobile. And I guess to pull in the musician and other performing artist part of it, that's years of compensatory body movements. So we start to use our bodies in ways that are abnormal.
Yes.
Nobody else holds their arm like this for that long besides a violinist,
Or if you can do a back bend,
right.
go to an arabesque where your foot is pretty much touching your head.
Right.
There's a really good chance it's only one specific segment of your spine that's moving.
Right.
Yeah.
So it's this concept of we're kind of fighting a little bit of an uphill battle against some of these things because these are years of ingrained exercises and then also genetic abnormalities to some extent, potentially.
Right. Well, if you're lucky. I mean, I
Right.
definitely grew up as a performer where I was not Gumby.
Not hyperflexible.
I remember being at auditions.
Yeah.
I did, because I grew up as a ballerina that had a career in musical theater. And I remember these girls lifting their legs up to their heads, and then just letting it go before even going into the audition. And I would just, I can't do that. Yeah. So, I mean, as much as from a medicine standpoint, it's not the best.
It's not good.
But we definitely understand that in the world, it's what you want. Yeah.
Exactly. And it's beautiful, right? It's lovely to look at. It makes for great art, but it's, it can become very detrimental, especially again, going back to as they age.
Yeah. Yes. And to go about it healthfully. So it's not just one part of your body that's moving to make it happen. It's the whole body working together for sure.
Right. Yeah, exactly.
All right. 4.
Okay. 4. This one I would say is usually having lack of a clear diagnosis. So I think dancers, musicians, people that work with their bodies so closely are very in tune to themselves. Yeah. And so they'll come in a lot of times with kind of vague symptoms. They'll say, well, just something doesn't feel right. And it's very hard to interpret that as, oh, well, it's obviously, XYZ.
Right.
So when you say, well, okay, it might be this, it might be that, let's just send you to physical therapy. Let's just see if we can just kind of fix things overall.
Because that's what's important. Getting you better, getting the performance better is what's important.
Exactly. Getting neuromuscular awareness back, getting some biomechanical function back, getting some stability back into the movement patterns is all very important. But I think without clear diagnosis, the dancers don't have a path. There's no light at the end of the tunnel for them. And I think that can affect them multiple ways, also emotionally too, and mentally. And so I think that can become a bit of an issue in terms of their rehab.
Yeah, for sure. For instance, you could have a torn labrum, so that, in your hip, some of your tissue there could be torn, and you're thinking that's the only problem, but there could be an injury before that could have led to that torn labrum.
Correct.
Cause.
Correct. Or the other way around, they might have a labral tear that you find on MRI, but that's nothing to do with the problem. But we get so excited. We're like, oh, there's a labral tear. Let me treat that. And then they're not getting better. And it's like, well, that was never an issue. That's been torn for 20 years. Who cares?
Right. Because injury does not necessarily mean dysfunction.
No. People are not textbook.
Right. Yes. We are all special, guys. Isn't that great? And isn't that difficult at the same time?
Exactly. So
number three,
I made it seeking help from the wrong providers. And I don't mean that in a way of disrespect. I mean that simply in a way of, I would never go to an electrician and be like, fix my plumbing. So, right? I wouldn't. That would be silly unless I really knew the guy well and I was hoping he'd be helpful. But otherwise, so it's the same idea. It's, it's hard to navigate medicine nowadays, especially with social media platforms make everybody a doctor or everybody a PT or everybody a trainer. And it can be really hard to navigate what's actually good for somebody and what's not, and who's the right provider for someone and who isn't. And I think so finding that person and finding the person that you can trust to help you get better is a huge factor. And if they don't trust their provider, they will not improve because they're never going to fully commit to the rehab.
That's true. That's very, very true. I just agree with you 100%. And when looking for, actually this happened the other day, I was working with one of my patients and she, oh gosh, my brain just totally just like went to outer space. Neverland, it's so great. Wait, help bring me back, Julia. Bring my brain back. So,
wrong providers, trust issues.
Oh yes. Providers trust. Saying what is the difference between asking me why I couldn't give a definite diagnosis. I'm a physical therapist, and I said that's not in my scope of practice. Right. And I had to let them know this is who you will go to get an actual diagnosis. And I had to break it down, but I understood their confusion. Right. But what you need to understand as a performer, as much as it's frustrating, it's also to our benefit that we have multiple different expertise within the health industry, because it's impossible for a mind to know that much and excel at all of it. Right. It's impossible. Right. So we have these niches so we can each be our very best for you.
Exactly.
All right, let's do number two.
Number two is, I think, and this is definitely bigger on the physical therapy side of things, having a medical treatment that's not really tailored to performing artists. So if you, get a meniscal tear, a lot of times your doctor might say you need to rest. Your physical therapist might say you need to work on some stability exercises. You need to maybe rest a little bit. You need to ice. Let's do these things. But it's too generic for the movements that dancers are doing. It's not, they don't need to just be functional in terms of their activities of daily living. They need to be functional beyond that level. And so I think if they are being treated at this kind of cookie cutter baseline treatment plan, they're not going to move anywhere from there. And they're going to feel that disconnect, and they're never going to feel like they're kind of back into their normal body.
It's so true. That's so true.
Yeah.
I love that. All
and
right.
time for the therapist, I guess, there too, right? Like,
we're coming back for time.
Pressure to see so many patients in the same hour, and it's how do you tailor the care when you don't?
It's so difficult. I mean, if we're looking at performing arts alone, so let's look at New York. I forget the numbers. I had a debate on this, physical therapy debate, and I included the ratio of physical therapists to the entire population in New York, and it was just, we were clearly understaffed there. Yeah, so if we're actually going to get specific on performing artists and the amount of physical therapists to the amount of performing artists in New York, we are still understaffed. Yes. So it is what it is right now. For a performer, if you're looking into a field to go into, recommend it. Doing physiatrist, physical therapist, anything within the health profession.
Please do. Yes.
Performing arts medicine. Yes. Which leads us to number one.
Number one, I think, is very important, and it's not even a big part of my scope of practice. However, I think it's a huge part of medicine: the psychological role of an injury, the impact it has on the emotional and mental well-being of a performer.
Because I'm in church, I'm like,
preach. Because this is the thing. When you are a dancer, when you are a musician, when you are a performing artist, that is part of your identity. That is part of who you are. It helps define something about you. I have a dancer tattooed on my ankle. I don't even dance that much anymore, but it's part of my identity. And it's the same idea that if you take part of that identity away and don't give them something to fill it, they're lost. There's a disconnect. And unfortunately, there's not a lot of sports specific psychologists for performing artists. It's just not a thing right now. And I'm, we're really hoping to try to find people that do excel in that area. But if we can't take care of a patient's mental well-being, their physical is not going to improve. It's just,
that's so true.
Fact. It's just the way it is.
That's so true. That's so very true.
Yeah.
Oh my gosh, I love that you hit upon that. That's actually because I do social media content myself, and with Powerful Performer, and the content I provide, I write once a week, and I'm fully tapping into the psychological aspect. I tell my own personal stories to be open, and create that relationship. But that's so huge. I definitely experienced, unfortunately, multiple times with injuries or sicknesses where you're trying to hide it from, if you can hide it from your cast and from your producer, from your director, what's going on, that's actually better for you. Because otherwise you'll get the reputation of, the girl who got laryngitis.
Right. You're the hurt one. You're the delicate one. You don't want to be delicate.
And also to add on, and this is something I say all the time, as much as being injured, being hurt is not normal, in the world of the performing arts, I'm sure we could generalize this too, but we're focusing on getting injured is normal.
It's part of life.
You are normal. If you get hurt, you are normal and you are enough. You have done enough. There are people here to help you, and just keep loving yourself because you are great as you are, and you'll get out of this. Sometimes just can take longer. Yeah, it's normal.
Yeah. Absolutely. You're doing your job. Let us do ours. Let us help you. That's what we're all here for.
Yep. Thank you so much for coming
You're
on.
welcome. Thank you for having me. Sorry I had to be in a hotel room to do it, but
I love it.
New England's lovely this time of year.
So for those who might be interested in seeking out a physiatrist, you know who to contact now. As I said, the information is in the bio and everything, so you can reach out. Thank you so much for coming on.
No problem. Happy to be here. Thanks for having me.